Hi, and thanks for tuning in to Pregnancy Pearls with Dr. Plenty. I am Dr. Nicole Plenty, board certified OBGYN and maternal fetal medicine specialist. Today we're going to talk about life after COVID 19. So, post COVID 19 life has been a little complicated. So, if you go back and look at my last video, at that time we only had about 300 cases in the US. Well, now we know we have tens of thousands of cases, and we have over 1 million cases worldwide of COVID 19. We know that COVID 19 primarily affects the lung, it causes flu like symptoms, and we know that people can be asymptomatic carriers and not even know it. So, life after COVID 19 means continuing to take care of ourselves and take precautions. What we've seen recently is one, some of the states are opening back up. Texas, the state I'm in, is starting to open back up. Florida is starting to open back up, and public areas are starting to open back up. So know that eventually things are going to open back up. But does this mean the scare is over? No, the scare is not over. The pandemic is predicted to last until August. And so for my pregnant mommies, that means that we need to especially take precautions. If you're trying to become pregnant, that means you especially need to take precautions. We don't yet know what COVID 19 does in the first trimester. So I know that I'm starting to see some appointments for some quarantine pregnancies, which is a good thing. A pregnancy is always a blessing, but it's scary in the middle of a pandemic because we don't know how the virus yet affects the embryo. Limited studies have shown that it doesn't increase the risk of birth defects, but obviously those studies are very limited. We also don't know what it does throughout the pregnancy, although we do know that patients that test positive for COVID 19 do have a higher incidence of being diagnosed with preeclampsia and other hypertensive disorders of pregnancy. And so once I see somebody that has preeclampsia, if you have any symptom at all or had any contact, I test you for COVID 19. And most of the time, those people are testing positive. People that are asymptomatic unknowingly can spread the virus just by not wearing a mask. A normal surgical mask doesn't 100% protect against COVID 19 either, which is why healthcare professionals have to take proper precautions to wear N95 mask, as well as eye protection, hair covering, and protection for our clothing so that we don't continue to spread the virus from patient to patient, room to room, or to our families. So asymptomatic people, because you don't know, that's why social distancing is in place. Social distancing means making sure you stay 6 feet away or more from people when you have to be in a public area. And when you don't have to be in a public area, it means staying home. I know that these states are opening back up, but we still have to take proper precautions and stay home when possible. If you don't want to cook or you feel like eating your favorite restaurant's food, order out and pick it up to go. Make sure when you go to the grocery store, you're wiping down all of your objects and wiping any surfaces the object touches. So spraying the back of your trunk with 70% alcohol or Lysol, wiping down hard surfaces with Clorox wipes, Lysol wipes, 10% bleach solution, or 70% alcohol. Making sure you clean your objects you buy, the packages, before you put them up, especially fruit and things that we're directly going to put in our mouths. Make sure you're wiping the outside of bananas and oranges. Use soap and water. Wipe them, wash them off, and then dry them, and then put them up so that when you're ready to eat them, they'll be good to go. So that is what we have to do post COVID 19. The other thing we have to do is we have to do things virtually. Unfortunately, some of you will not be able to have your baby showers. Some of you will not be able to celebrate birthdays. Some of you will not be able to take maternity pictures. And I get that. That's a sad time, and we want to make sure that we are capturing these moments. But I urge you to be creative with what you're doing. Have a virtual shower, even if you're going to have a sip and see or a shower at a later date after the pandemic is over. Start a blog or open a new social media page for just your family to follow so that they can see your pregnancy milestones or your baby's milestones. Harrison, my son, which you guys have seen on some of the videos, and you might even hear him in the background, he will turn 1 on June 3rd. And unfortunately, although we planned this big shindig because he's our only child, we had to cancel it because we want to make sure we're keeping him safe, we're keeping our family safe, and we're also practicing social distancing. So we plan to have his 1-year-old birthday party somewhere in the fall or the months to come. And is it really the end of the world if we can't celebrate those things if it saves lives? No. Our safety and our health is first. And so we want you to be around for a very long time for your baby. To make sure your baby is safe and raised the right way. So if we have to postpone his party, we just have to postpone his party. We'll do something virtually. And so I do encourage you to stay connected with your family virtually. Pregnancy is also a very common time for domestic abuse. I've talked about this in my other videos. And I've seen that post-COVID-19, because people are losing their jobs in the house, I have seen those cases increase. And so please reach out to your provider and let them know what's going on so that we can help you, okay? It's harder for us to screen you because we're not seeing you as much. Your OBs are not doing face-to-face visits. A lot of them aren't post-COVID-19. So if you happen to see a subspecialist, like I'm a maternal fetal medicine doctor, a lot of the MFMs are still doing in-person visits. So whoever you can see in person, if you don't feel like telling them virtually because you have a family member that's in the room, please email, reach out, or when you see a subspecialist or your actual OB face-to-face, let them know what's going on so we can get you help. So face mask in public also is the new wave post-COVID-19. Unfortunately, we have to make sure that we're not spreading anything as an asymptomatic carrier, and you're not getting anything by thinking that people are not infected. We are now screening all of our pregnant women in most of the institutions that I have privileges before they get C-sections or vaginal deliveries. And unfortunately, whether you test positive or not, most facilities are not allowing you more than one visitor. So please don't get mad about that. We're trying to do the best we can by limiting the amount of contacts providers and other patients have with outside patients or outside people and visitors. So please just know that everybody's doing the best they can, especially until we get enough protected devices and equipment to make sure we are containing the spread of this virus. One more thing, I know that a lot of us aren't going outside, and so vitamin D deficiency is a real thing. Make sure you get some type of sunlight during the day, whether that's just walking outside on your porch. You do need about 5 to 10 minutes to get your vitamin D in, and this is not the time to not take your prenatal vitamins, especially because you do need vitamin D and the other vitamins that are included in there because you're not really going outside. So make sure you're eating a well-balanced diet and make sure you take your prenatal vitamins. If you have issues with nausea and vomiting, let your OB know. We have things that can fix that. And as always, please click subscribe below. Please subscribe to my channel and make sure to follow me on social media. I'm on Twitter, Facebook, and Instagram as Pregnancy Pearls with Dr. Plenty. Instagram pregnancy_pearls. Thanks.